Jehovah Lord, for those afflicted by the effect of antimicrobial resistance, we commit them into your able hands. We pray this believing and trusting in the holy name of Jesus. Amen. Thank you.
Amen. And you may have your seats. Just a few housekeeping matters before we begin our session this morning. Number one is to let you know that the restrooms are to your right if you need to go to the restrooms. Number two is, if you have not registered, kindly ensure that you do register. I'm informed that there are those who participated in the media briefing event earlier on, and you did register there. Kindly note that you are required to register again. So please, if you have, do so. And finally, those with posters, you are requested to ensure that your poster has been put up. Kindly see Dr. Gavin Orangi. Gavin, you could probably wave your hand so that we can all see you. So if you have a poster and your poster is not up, kindly see him and he'll assist you in putting your poster up. Otherwise, I want to take this opportunity to invite Dr. Irungu Kamau to come and give us some opening remarks. And as he comes, just to let us know why we celebrate the World Antimicrobial Awareness Week each and every year. So the World Antimicrobial Awareness Week is commemorated annually to raise global awareness of AMR and to encourage responsible use of antimicrobials in humans, animals, and the environment. It serves as a global call to action to preserve the effectiveness of antimicrobials and to combat the growing threat of AMR. Thank you, Dr. Irungu.
Yeah, thank you so much, Collins, and good morning, everyone. Good morning. It's not cold, so I believe we are well energized. Yeah, my name is Dr. Irungu Kamau. I work with the Ministry of Health, and in this context, I'm in the NASIC Secretariat, that is the National Antimicrobial Stewardship Interagency Committee. And on behalf of NASIC, I wish to welcome all of us to Movenpick as we commemorate this great week where we talk about antimicrobial resistance. So particularly on my behalf and on behalf of NASIC, it's a great honor as we gather to officially launch the World AMR Awareness Week 2024, and specifically for our country, Kenya. And we are cognizant of the theme, which is Educate, Advocate, and Act Now, which basically serves as a call to action for each of us to address a fairly significant public health challenge that we are facing. Kenya, of course, like many other countries in Africa, faces unique challenges in combating AMR. And like in our country with a population of 50 million people, our healthcare system sometimes is stretched to its limits. And we continue seeing misuse and overuse of antimicrobials in the human health, in the animal health. We are having a lot of effluent in our environment. But we know that we have a potential to lead the way in this fight. So the essence of this year's theme, as we have said, lies in three pillars. That is educate. So it's incumbent upon us to educate our healthcare workers, our farmers, our policymakers, and the general public with knowledge about the dangers posed by the misuse of antimicrobials and the key role played by infection prevention and control and farm biosecurity in mitigating AMR. We need to, the issue of advocacy. Advocacy requires a strong leadership collaboration, so we must ensure that AMR is prioritized at the national health policies, at the subnational health plans, and all the way to our implementation within our communities. So it is upon us to push for sustained funding, a robust antimicrobial stewardship programs, and also being able to avail affordable diagnostics to support evidence-based practices. So then we have to act now. So every day, of course, brings us closer to a situation whereby infections would be harder to treat if we continue misusing our antimicrobials. Therefore, we need to act now and take it upon all of us to mitigate this scourge. So this room, of course, demonstrates the kind of partnership we have, the kind of collaboration, which is a great insight in the dedication that all of us have in the fight against AMR. So thank you so much, and we wish all of us a very, very successful week. Asante sana.
Thank you so much, Dr. Kamau. We move to our next speaker on AMR and National Action Plan implementation, Dr. Romona Ndanyi. Karibu sana, Daktari.
Good morning. Our chief guest, sir, Mr. Wasonga, representative of Ministry of Health, Dr. Kandie, all protocols observed. Ladies and gentlemen, good morning again. Where I come from, greetings are very abundant. Thank you. So I've been introduced. My name is Dr. Romona Ndanyi, and I'll quickly take you through this presentation on implementing the National Action Plan on AMR. And before I start, maybe just to ask you to bear with me. I have been through some AMR issues as well. Yeah, because of the cold, I had a sore throat, and I'm still trying to get used to my very hoarse voice today. I usually have a sweet voice. So bear with my hoarse voice for this week. So we're going to go through what we've been doing as NASIC in implementing our National Action Plan on AMR. And before I start the presentation, maybe just to inform all of us here that we've had our first iteration of the National Action Plan that was running from 2017 to 2022. It was a 5-year plan, a very ambitious plan indeed. Then by end of 2022, we reviewed the first National Action Plan and developed our second iteration that's running from 2023 to 2027. So currently we are on the second iteration. But my presentation on what we have been able to do will capture what we did in our first 5-year plan, as well as what we've been able to do as we started implementing our second National Action Plan. So just to start us off, as my colleague has already said before me, AMR, antimicrobial resistance, is one of the greatest global health challenges of our time. And it's becoming a leading cause of death globally. It's a growing threat in both animal health and human health, and affects our livelihoods and also affects food security worldwide. And currently, the World Health Organization has listed AMR among the top 10 threats for global health. Do we know about the other threats? Anybody? So AMR is among the top 10. What are the drivers of AMR? One of the drivers is overuse and misuse of antimicrobials, both in humans and in animals. We've seen a lot of misuse in terms of over-the-counter access to antimicrobials, getting antimicrobials without prescription, and sometimes not finishing a dose when certain antimicrobials have been prescribed, and that would lead to AMR. Other drivers include poor infection control practices, inadequate access to clean water and to clean sanitation. Because when we have clean water, we have clean sanitation, then we reduce infections, both in humans and in animals, as well as other agricultural practices. Another driver is environmental contamination, because whatever it is we do in animal health, whatever it is we do in human health, somehow ends up in the environment. And when we contaminate our environment with, say, the resistant pathogens, or even the antimicrobial, then we accelerate the development of resistance in the microorganisms that are in the environment. Poor quality of drugs is also a driver. Yeah, and then suboptimal diagnostics. What do you mean by suboptimal diagnostics is if we are not able to properly diagnose the infections that are affecting either humans or animals, then we can't give the correct treatment. And this calls for, use of proper use of laboratories to ensure that we get the correct diagnosis so that we can treat our animals using the correct dosage and the correct antimicrobials. This slide just shows you some of the impacts of antimicrobial resistance with regards to how it's affecting the Sustainable Development Goals. And from what we have described what AMR is, you can clearly see how it can lead to poverty. It can affect our universal health coverage. Because if there's an increase of infections, we are not able to treat our infections properly. We have increased number of days that people have to stay in hospital because the drugs that we have are not working. Then universal health coverage is affected and is not attained. With regards to economic growth, because animals are affected, our livelihoods are affected. And for us in Kenya, being an agricultural country, if our animals are not able to produce to the extent that they should, the proper extent, then that will affect our economic growth. If humans also are not getting well, are sick all the time, or we have so many people dying, we also lose the workforce in the country, and therefore that also affects economic growth. The other SDG that's affected is health equity and socioeconomy and gender. Let's just look at some of the impact, and I think Dr. Irungu mentioned some of them. What we have currently is that in 2019, it's been shown that the effect of AMR affected about 1,270,000 people. Yeah, this is it caused deaths of 1,270,000. 1,270,000. Get that right? And it is estimated that by 2050, this number of people dying due to AMR will increase to 10 million. So then it will become a #1 killer, and specifically in Africa, where we have issues with our health system, we have issues with our agricultural practices, the impact is going to be greatly felt. So today, we are seeing more than 700,000 deaths. I think this was data that was taken in around 2015 due to AMR. So postulated by 2030, it would get to about the cost of AMR would be around 3.4 million every year. You can try and figure out that. That's not in Kenya shillings, that is in USD. So you can imagine the impact. And as I said earlier, it is postulated that by 2050, if we do nothing about AMR, we will be seeing AMR causing deaths of about 10 million people each year. So we need to act now. We need to educate ourselves, advocate for AMR, and act now. And how we addressing AMR in Kenya? We're using the One Health approach, and I think my previous speaker talked about that. We have to use a One Health approach and ensure each and every one of us is involved. Each organization that, each sector that has a role to play, plays a role in addressing AMR. So why are we using a One Health approach? Because this is an issue that affects multiple sectors. And we're talking about the Ministry of Health or the health sector. We are talking about the agriculture sector and the animal health sector. We are talking about the environmental sector, which is very important. And we are glad that now we are actually seeing a lot of effort globally as well as in the country to involve the environmental sector in addressing AMR. We also have other sectors that play a role. I know we have some of our counties that have involved, for example, the education sector, which is very important because if we start educating our young people early enough, then we will have champions early enough to address AMR. So how did we start addressing AMR? There was a call way back in 2015 by WHO, and they came together with that time it was the three sisters, the tripartite. That was WHO, FAO, and OIE, who developed the Global Action Plan on Animal Antimicrobial Resistance. And after that, all countries globally were called upon to adopt the Global Action Plan and advocate and start working towards tackling AMR. So Kenya, we managed to develop our national policy and our first national action plan in 2017. You can see the photo there. Sorry, I don't have a pointer. And then after 5 years, we developed our national action plan, the second iteration that runs between 2023 and 2027. Just to point out is that when we developed the first national action plan, we only had the Ministry of Health and the Ministry of Agriculture through the Directorate of Veterinary Services that were involved. So that's the only One Health picture we had then. But as we moved along, we brought in the other sectors, so that as you can see, our second iteration of the National Action Plan has been signed by multi-sectors. We have the Ministry of Health, we have the Ministry of, the Cabinet Secretary Ministry of Health, the Cabinet Secretary Ministry of Agriculture and Livestock Development. Then we have the Cabinet Secretary Ministry of Environment, Climate Change and Forestry. And the fourth one is the Cabinet Secretary Ministry of Mining, Blue Economy, and Maritime Affairs. Yeah. Blue Economy is where we get fish, and fish being part of our food system and where we can also get AMR is important. So currently, the four ministries are working together hand in hand to tackle AMR using a One Health approach and implementing the National Action Plan together. So I'll just take you through a snapshot of what we have in our National Action Plan to share the strategic priorities that we have captured or outlined in this snap. So we have 6 objectives. This is different from the Global Action Plan, for those of you who are aware of the GAP. The GAP has 5 objectives, but for us in Kenya we have 6. Because from the lessons learned during the implementation of the first National Action Plan, we realized that we needed to build capacity in governance. So we had to pick that out and put it specifically in our National Action Plan so that we come up with activities of how we are going to strengthen our governance and coordination in in addressing AMR. So the first objective is to establish and strengthen governance coordination mechanism at the national and county levels. The second one is public awareness and education, and this is one of the activities that we usually carry out every year as one of the activities under this objective. And our main focus is to improve awareness and understanding of AMR through effective communication, through education, and through training. And I believe we are doing that very well today. Our third objective is surveillance and monitoring, focusing on strengthening the knowledge and evidence base on AMR through surveillance and research, because we need homegrown evidence. We need to know what exactly is happening in Kenya for us to know exactly how then we can address AMR. So we're doing that through surveillance. The fourth one is IPC, infection, prevention and control, and hygiene. In this objective, our aim is to reduce the incidence of infection through effective sanitation, through hygiene, and through IPC. For those of us who are from the animal health sector and the agriculture sector, basically you're talking about proper farm biosecurity measures and good husbandry, both for animals and for plants. The fifth one is appropriate use of antimicrobials. Our focus is to optimize the use of antimicrobials in human, animals, and plant health. And the last one is research and development. This is to support sustainable investment and increase investment in new medicines, diagnostic tools, vaccines, and other alternatives. And I'm glad I can see we have representation from the research institutions here. And we'll have a number of presentations that will be presented today and tomorrow that will showcase what we've been doing, what kind of research we've been doing towards addressing AMR. I've talked about multisectoral governance. That's our first objective. And for us in Kenya, we do have a structure which we use, our governance structure that we use for addressing AMR. And this structure has a level at the national level. We have a national level and the county level, because most of these activities, most of these sectoral aspects are devolved. So at the national level, we have the National Antimicrobial Stewardship Interagency Committee that consists of the 4 ministries I've mentioned earlier. And it consists of the steering committee that's led by our PSS from our CSS and PSS from the 4 ministries. We have a technical committee that's led by the directors in these ministries. And then we have the AMR Secretariat. In other words, the Kanda ya Moko, the ones who steer the wheel at that low level. So how do we coordinate our work with the CASIC? We do this through the intergovernmental relations. Then we have recommended that at the county level we do have the county antimicrobial stewardship interagency committees, and these currently we have established 20 of them. In Nyeri, in Murang'a, Mugoma, Kisumu, Kilifi, Mombasa, Kakamega, Makueni, Trans Nzoia, Machakos, Kiambu, Uasin Gishu, Embu, Bomet, Nairobi, Kisii, Nandi, Busia. The new kids on the block are Laikipia and Kitui. Please clap for these CASICs, because without having people at the ground, then on the ground at the mashinani, then it would not be possible for us at the national level to make any impact. So our second objective on awareness, I'll just go through some of the milestones we've been able to make, or some of the achievements. In enhancing public awareness, we've been holding AMR awareness campaigns every year since 2015. We have an AMR communication strategy, and this has been reviewed thanks to Red Cross, I think, and Rocket. We develop a number of IEC materials and bulletins which we share with our counties so that we can spread the message across. Then we usually have advocacy meeting. We've had one this year with the Parliamentary Health Committee to advocate on adoption of AMR and funding for AMR. Then a number of conferences we usually hold across the year. For example, last year we had the IPNET Kenya conference, and then we had AMR Scientific Symposium. And then we have a number of other conferences that are held, and some of these conferences, like the KVA National Conference, usually has topics or themes that cover AMR. Another way we've been carrying out awareness is promoting education and training in AMR and IPC by sensitizing professionals on AMR, IPC, antimicrobial stewardship, biosafety, and biosecurity. Then we also have been carrying mentorship both physically and virtually. And another activity we've been doing over time is working hard to build capacity of our media personnel on AMR. Like earlier today, that's what we were doing between 7 and 9, sensitizing our media so that we are able to get the message out through our media houses. Still under awareness, promoting education and AMR and training on AMR, AMR is covered in some of our pre-service training and also most of our in-service training. And of course, we also have continuous professional development in human health and also in animal health that cover AMR. We also have been conducting training using standardized modules. We have one module for AMR surveillance, for example, that has been posted on the Ministry of Health website and is available for anyone who's interested in learning more about AMR to access. A mentorship also is carried out both on-site using a platform, for example, the ECOF platform, which integrates AMR, antimicrobial stewardship, IPC, and others. On to surveillance, what have we been able to achieve? We first and foremost started by establishing our AMR national reference centers. And for human health, our reference center is the National Microbiology Reference Lab. And for animal health, we have the National Veterinary Reference Lab in Kabete. Those are our reference center for AMR surveillance. In addition, we have sentinel sites that we have established. So we, as a country, we agree that our sentinel sites will be, for animal health, will be the veterinary labs, and for human health will be the healthcare facilities or hospitals. So currently we have a total of 24 sentinel sites, and we are still working on increasing the sentinel sites, because this is where we would get the data that then can show us what kind of AMR trends we have in the country. What we do is that currently we are able to report our surveillance data annually. So for human health, we report to WHO GLAS, and for animal health, we have now started the process of reporting to a new platform called Infam, so that we share our data globally, and anybody who's interested can actually see what is happening in Kenya. And we also can use to come up with policies with regards to AMR. Still on surveillance, we've also been able to work on quality assurance of our data and of our procedures in the laboratory. We have been able to standardize our laboratory procedures across human health and animal health. We have enrolled all our surveillance sites, and all of them are able to carry out external quality assurance programs, so that whatever results that these labs give, we are assured that these are good quality data and they can stand the they can actually be used for decision making. We also have isolate referral and retesting, so that we are able to gauge what our sites are doing, and where we have issues, then we can address that. So in implementation of our laboratory quality management system, which is very important for surveillance, I'd like to maybe mention that the National Microbiology Reference Lab at the National Public Health Lab is accredited for bacteriology tests under the ISO 15189 version 2012 by KENAS. KENAS is the Kenya National Accreditation Services that we use for accreditation. The NMRL is also accredited as a national external quality assessment provider under ISO 17043. The lab in Kabete has accreditation for bacteriology test and AST, that is antimicrobial susceptibility testing, to ISO 17025, the 2017 version, also by KENAS. And we have 8 of the 18 labs in human health that are in the surveillance network that have been accredited to 15189. So this is to show you that whatever data that we share with our partners, the data that we share with our policymakers, is good quality data. This is just to show you what we are able to produce from our surveillance sites. We use laboratory information management system, and we have different systems for human health and animal health. And we also were able to develop a One Health AMR surveillance system, which then compiles or collates all the data from human health and animal health into one dashboard, and then this can be visualized by the personnel who have rights to visualize this data. It's our hope that we can actually extend the right to our policymakers, so that they'll also be able to, at a click of a button, be able to see the kind of data that's coming out from our surveillance sites. And you can see the kind of maps that this system is generating. Very informative maps. You can see the one on top, just showing us where, for example, E. coli resistant to gentamicin is found in the country. And the one below, that is in humans, the one below can just, you can just visualize E. coli resistance, for example, to tetracycline in animals. The areas in red, that's where we have some resistant E. coli. A very good system. Yeah. See, just still on surveillance, my apologies, because I have a bias to surveillance. I may talk so much about surveillance. So if the issues with time, please, moderator, please let me know. Yeah. So over time, we've been able to increase the number of samples that we're seeing from our health facilities, as well as the ones that we're seeing coming in from animal health. So all the way from 2018, we only used to get about 64 samples only for surveillance of AMR. And today, we are talking about over 26,000 samples. In animal health, comparing 2022 and 2023, in 2022, we only saw about 7,000 samples, and now we can see we are increasing the number of samples. And the more samples we get, then the more data we can get to enable us make better decisions on trends and how to address AMR. This just goes to show the kind of specimens that are tested in the laboratory for purposes of AMR surveillance. In humans, mostly we get blood samples. About 32% of most of the samples are blood samples. This is followed by urine samples. We also have others, various swabs. We have stool samples, urogenital, central CSF samples, among others. On the other side, in animals, we are seeing a lot of bovine milk as the samples, specifically for passive surveillance, and avian cloacal swabs. And the reason why we have a lot of avian cloacal swabs is because we had a big project that was looking at surveillance in poultry But most of the times, most of our samples, the samples that are handled in animal health are bovine milk samples. We've also agreed on the priority pathogens, both in humans and animals. And you can see that E. coli features, we can see Salmonella, Staphylococcus aureus, Klebsiella pneumoniae, Pseudomonas aeruginosa, yeah. And these are featuring both in human health and animal health, showing the importance of why we need to address this using a One Health approach. What kind of data are we seeing? Surveillance, when you're carrying out surveillance for AMR. Just a snapshot. For example, when you look at the E. coli that we've been able to isolate, most of them are susceptible to meropenem, to amikacin, and to nitrofurantoin. However, we're seeing high resistance to fluoroquinolones, ciprofloxacin, and just to take note that we use a lot of ciprofloxacin also in animals, and we use a lot of cotrimoxazole in animals, and you're seeing resistance in human samples. Just to show you also what's happening in the animal arena, E. coli, just using E. coli, susceptible to meropenem, to ceftriaxone, and to gentamicin, but then high resistance seen in ampicillin, in cotrimoxazole, and in tetracycline. We also have, under our fourth objective, infection prevention and control, biosafety and biosecurity activities. So in interest of time, maybe I'll just skip this because I'm sure we'll have a presentation on IPC at a later stage. Yes, I think somebody talked about the importance of hand washing. And we've tried to look at data that shows how the impact of hand washing, to getting infections. And all of us can take note of what happened during COVID, when we had or rather we were forced to comply with hand hygiene. There was a reduction in infections, and actually I think some hospitals were crying, some pharmacies were crying, they were losing business because nobody was falling sick. I think we should go back to that era. Under promoting prudent use of antimicrobials, we have developed guidance. For example, you have the National Antimicrobial Stewardship Guidance for healthcare settings. We also have the guidelines for prudent use of antimicrobials in animals. Other documents that we've produced or developed that are supposed to assist us to promote prudent use are as shown. We have the essential essential medicines list, then the national medicines formulary, the essential diagnostic list, the essential medical supplies list, and specifications for Kenya essential diagnostic list. There's a reason why I said veterinary, because that's one of the things we are doing next week. We are coming up with an essential veterinary medicines list as well. Other than that, we also have antimicrobial use and antimicrobial consumption monitoring. In a nutshell, I'll just talk about AMC as the aggregated data, such as import data, wholesale data, of all the antimicrobials that come into the country, and AMU would be tracking exactly what kind, where these antimicrobials are used. And we do have two regulators, that is the Pharmacy and Poisons Board and the Veterinary Medicines Directorate, that monitors AMC at the national level. This just shows you the kind of data we are getting from antimicrobial use, or on antimicrobial use and consumption. And you can see in animal health, we have a lot of tetracycline that comes in for purposes of animal health. We also have aminoglycosides, penicillins, and macrolides. Then the other graph just shows us the comparison between antimicrobial use and use of microbiology lab for diagnostics. And you can see we are not doing very well. For the 8 hospitals that were monitored, it's only one that actually uses a lot of microbiology lab to give direction on which drugs to use. So that's an area that we need to improve. Under research and development, we have a number of research projects. Quickly through them, just the Rocket project is a One Health project spanning Kenya, Uganda, Ethiopia, and Tanzania, and that project promotes local research. Local research and collaboration across sectors to strengthen decision-making in AMR. We also have various researches that have been carried out, some sponsored by or supported by USAID MTAPs, by Cambry. Let me not, in the interest of time, I'll just go through. We have one that's supported by Danida, looking at quali-food, improving milk and chicken meat products. We have climate-smart agriculture technologies that also look at improving the husbandry of agricultural practices, and others like MadTech, looking at how we can also use ICT to control AMR in Africa. I think this is my last slide in interest of time. Thank you very much.
Thank you, Dr. Romana. Very passionate about surveillance. We had a media briefing in the morning, and there are lost and found items. So in the event that you forgot their car keys and a notebook in the media briefing room, kindly pick them from our desk. So next we do have, in the house we have sponsors, our partners who are here with us. And maybe going back to Dr. Romona on the National Action Plan, from a personal perspective, in your own sphere as an individual, what are you doing to prevent antimicrobial resistance? I do not want an answer from you, but just consider that, and if there is anything you need to do, please do it to create awareness so that we can stop this plague of AMR. So we are so grateful and honored to have our partners in the house, and in the interest of time again, I would want them to come forward and make some remarks. I want to call upon Fleming Fund. Just take maybe about 3-4 minutes so that you can make your remarks. We do have Fleming Fund, we do have USAID, we have CDC, Kenya Red Cross, Biomerio, we have the quadripartite. If we do have representative from those organizations, kindly step forward so that you can make your remarks. Thank you. And as they come forward, let's clap for them. Thank you so much, Bwana Boliva. Karibu sana. You can use this one, or you want to move around?
No, this is fine. Good morning, good people. It's always good to be fast, isn't it? Then you hog the space and take over everything. Our guests, invited guests, ladies and gentlemen, my name is Boliva. I stand here as a representative of the Fleming Fund that is involved, has been involved from the beginning of the National Action Plan in Kenya. And we are proud to be associated with the government of Kenya. We work alongside them to enable them and help them execute the mandate of AMR. We work as a consortium in Fleming Fund. We currently are a consortium of 2. ILRI, which generally handles the entire project, and ILRI, the arm that handles the animal health sector. We partnered with the University of Nairobi, which handles the human health sector when it comes to AMR. In the NAP, we are leaning more towards the surveillance section of the NAP. In the initial phase 1 of the project, just to take you back a little bit, we did a lot of work around renovating and equipping of some of the Sentinel sites. We are working in just slightly under 20 surveillance sites. We did a bit of renovation of some of these sites, put in equipment, bought lab reagents, did a lot of capacity building on the lab people, and this is an ongoing process even as we speak. Reagents and consumables, including PPEs for the lab staff, and capacity building of the lab staff and other interested parties. But when it came to the second NAP, I might be mixing people up. The National Action Plan is the NAP, not that we went to sleep. It is a National Action Plan. The second National Action Plan, we are actually focusing on data and retrieval of data and generation of this data, and to see how can this data then be used to create policy. As you saw some of the data that has been presented out there, there was only one hospital that was actually using the data they have to create a clinical interface with the lab. And that is an important state for us, because without that data, we would not know that it's only one. Now we know. Now we are able to encourage the other sites, especially to start using the data that is being generated. From Fleming Fund, we initially worked a lot with the human health and the animal health, but I'm proud to say that in phase 2 we have strongly and deliberately moved to include the environmental sector in this space. We know that there are many sectors that would be involved. It's a cross-cutting One Health initiative, but the Chinese say that the journey of 1,000 miles begins with one step. So we began with the animal and human health sector, and in phase 2 we are vigorously engaging with the environment sector. And also we have deliberately in phase 2 started to include a little bit of the private sector in human health, because that's an area that has been neglected for quite a bit of a while, and we are able to get a lot of data to inform us what is happening in the market. Fleming Fund also, Fleming Fund is structured in such that we have the country grant that is run by ILRI. Professor Eric was here a few minutes ago. Unfortunately, he had to run off. The seat was biting him because he was in a meeting and he kept on postponing. And I can see I'm being warned. Can I borrow another 1 minute, Dr. Ari? Yes. We have regional grants. We have the country grant, which oversees the country implementation. And then we have the regional grants that you have heard being mentioned here, some including FIND, who have done quite a bit of work on technical assistance, and also digitization and optimizing the network, because the CDW, the Central Data Warehouse that you see here, was implemented by the Fleming Fund, and FIND is actually doing a lot of work in that space. Some people like Radar, ASLM, EXA, AMRO, giving all sorts of technical assistance through the Fleming Fund as regional grants. And then we have some of them who are also strategic alignment grants. I can see they are looking at me badly, but it's okay. I have the microphone, so I might as well steal another 1 minute. Just to quickly, in moving forward, the issue is sustainability. How do we sustain these gains that we have had for the last 7 years? In our mind, our key ask, our key plea to government is to try and include these gains into the government structures. The revenues, the equipment that has been put in these labs is costs a tidy sum, and it would be a shame to leave them to stay there as white elephants. It would be great to see that these equipment and infrastructure and training is included in government budgets, both county and national government, so that we have some form of sustainability of these efforts. I think I want to stop there, because if you leave me here, I'll start talking politics, and that is not good. So I want to thank you so much. Thank you for the opportunity on behalf of Fleming Fund, the Director General of ILRI, and the entire Fleming Fund fraternity. Thank you so much for the collaboration that you have given us. These doors we knock and we are let in, we don't take it for granted, and we look forward to supporting the government more and more to achieve what they need to achieve in the AMR space. Thank you so much.
Thank you. Thank you, Dr. Buliva. I can tell you are a bully from primary school. So I want to call upon Dr. Lois Ombajo from the University of Nairobi. Just a minute. So that she can finish the other wing of the collaboration between ILRI and the university. Thank you.
Thank you so much. Good morning, Yes, good morning, everyone.
Good morning.
So you say good morning. Good morning, everyone. All right, I think mine is really thank you all for coming. I think everybody in this room is here because of the passion they have for mitigating AMR. Also to thank the Ministry of Health, because they've given us incredible support as we've worked, particularly supporting the human health activities in Fleming Fund. I think UON has been privileged to support a number of activities, working with the counties, working with several facilities to work on antimicrobial stewardship, supporting issues of data review, and importantly, supporting use of data in developing antibiograms. And as we'll see today, we now have for the first time the national guideline on antibiotic use in human health. So we're incredibly proud and really privileged to have worked with very many people in this room and very many people working in the counties. And I just want to echo something that Bolivar said around sustainability. And this goes to the Ministry of Health. It's not every day that you get the opportunity to address the Ministry of Health, Dr. Kandia and your team. If we go to many of the labs that we're working in, practically everything that's being used in the microbiology lab is currently being supported by a partner. And the question is, once some of this funding ends in a year or months, what happens next? Will we have no data? So the Ministry of Health really has to work at ensuring that government supports some of this work. As Kenyans, we cannot continue to rely on partners for forever. We have to think about how does government support the work that needs to be done in order to control AMR. So that is a task that we send you back with, that next budget will hear flour, transport, AMR will be right on that list in the budget, that we must think about how we fund the work that we do. And I think for everyone is that AMR is never an individual activity. It's about people working together, people collaborating, whether it's in infection prevention and control, whether it's in surveillance, whether it's in developing guidelines, and in antimicrobial stewardship. We all have to continue working together. So let's advocate and let us act now. Thank you so much for the opportunity.
Thank you so much, Dr. Lois Ombajo. Could we have the next speaker, kindly? There was a gentleman. Take the stage, please. Karibu.
Okay, thank you. Thank you very much. My name is Dr. Paul Olale from Kenya Red Cross. And I will start by saying that there is a privilege to be part and parcel of this commemoration of the World Antimicrobial Awareness Week, that is 2024. As Kenya Red Cross, we are working on a project on antimicrobial resistance with One Health approach that is actually under the Rocket Consortium, which we are in with ILRI, KEMRI, that is in Kenya, and then we also have the Ethiopian Institute of Public Health, that is in Ethiopia, and then we have Muhimbili in Tanzania, and we also have Makerere University in Uganda. So I'll just take a minute or two to give us a brief of what we're doing in the country. And ours as a consortium is basically communicating to the second and sixth strategic objective of the NAP, that is public awareness and education. And we have the research and development. The research and development wing is actually taken care of by KEMRI, which is actually much more into evidence-based diagnosis, trying to capacity build our key referral laboratories, something that has actually begun. It was launched last month. On the Kenya Red Cross wing, we've been basically on community awareness and community sensitization, majorly in 2 counties so far, that is in Kajiado and Uasin Gishu, where we've been able to capacity build community health promoters and sub-county teams, the chairs and some of the PHOs at that particular level, basically to be able to do a household level kind of sensitization against communication around risks and consequences of inappropriate use of antimicrobials. So this is something that has really been happening since June this year, and it has taken shape. And we appreciate the kind of feedback that we are getting from these particular sets of communities. Hoping that now we are really going to intensify this with the WOW. There is active rollout that is actually going on from today throughout this particular week, where we're really going to get into the households just but to spearhead what has been going on. So with those many remarks, I think because of time, I would want to stop there. But again, it won't be justice to stop actually calling upon the ministry. You know, again, I'll echo what Dr. Mbajo said. Getting an opportunity to speak to the ministry is always not an easy opportunity. Yeah, I think, again, we just need to at least have, as a ministry, an allocation to this particular bit, because AMR is really a problem, it's a real challenge, and from the data that we're seeing here, there have been little consideration as far as One Health is concerned, and I'm happy that we have the NASIC. If we can easily be able to have this cascaded down so that the CASICs in all counties, we have very few. We have all the CASICs capacity built or strengthened. I want to believe that we are gonna be able to revert to whatever projections that are here by 2050. Otherwise, thank you very much, and let's have a good week. Thank you.
Thank you, Mr. Olale. A hand clap, please. Let's have our next partner. Karibu sana.
Good morning. I don't know if you are like me, but the figures that were given, the 1.27 million, were mind-boggling for me, and I hope the same was for you in terms of taking action with regard to AMR moving forward. My name is Joshua Kimutai. I'm privileged to stand in front of you on behalf of FAO, and I'll be giving the remarks on behalf of our FAO representative, Ms. Nabenyi Tipo. Our chief guest, Mr. Jude Wesonga, representative from the representative of the PS State Department of Livestock and Development, Ministry of Health, Dr. Charles Kandie, Director Health Standards, Regulation and Quality Assurance, representative from the DVS, Dr. Evans Muthuma, representative from CEO KVB, Dr. Benson Kibore, a representative from Calro, Dr. Monica Maichomo, and last but not least, from KEMRI, Dr. Robert Onsare, as well as acknowledging the partners from the quadripartite who are here, WHO, UNEP, World Organization for Animal Health, I'd also like to recognize representatives from the funding agencies and implementing partners, namely from USAID, Ricardo Echela, the research institutions, universities, all protocols observed, ladies and gentlemen. On behalf of FAO, it is a privilege to join you for this World AMR Awareness Week, an urgent call to action highlighting the growing global crisis of AMR. FAO believes that we must respond with coordinated and sustained efforts to combat AMR and protect public health across all sectors and along with the agri-food systems. Your Excellencies, dear guests, ladies and gentlemen, this year's theme, Educate, Advocate, Action Now, underscores the need for raising awareness, advocating for strong commitments, and taking immediate action across all sectors to tackle AMR. During the recent 79th UNGA, United Nations General Assembly, high-level meeting on AMR, Kenya joined global leaders in pledging to ambitious targets, which includes a 10% reduction in AMR-related deaths by 2030. The UNGA 79 Declaration emphasizes the need for sustainable national financing and robust funding mechanisms to support global AMR initiatives, which highlights Kenya's commitment to this critical fight in alignment with global initiatives. As a result, FAO acknowledges the Kenyan government commitments to these crucial initiatives and supporting the Declaration's appeal for multisectoral approaches to AMR under the auspices of One Health frameworks. Kenya is also proactively promoting the FAO initiative known as RhinoFarm, which is the reduce the need for antimicrobials on farms for sustainable agri-food systems and transformation. This was mentioned by Dr. Ramona, which was launched in April 2024. And also INFARM, which is the International FAO Antimicrobial Resistance Monitoring, which was launched in early 2022. This represents FAO's global efforts to minimize the reliance on antimicrobials in agriculture as a means of combating the growing challenge resulting from AMR. RhinoFarm is designed to transform the agricultural practices significantly on reducing AMR use on farms through enhanced biosecurity, infection prevention, and improved animal health management. With the rise of AMR, there is increasing pressure on agricultural systems to minimize the use of antimicrobials, which can lead to drug-resistant infections affecting both animal and human health. And this is where RhinoFarm comes in. It aims to preserve the effectiveness of these essential drugs and promote sustainable food systems by emphasizing preventive health measures and responsible antimicrobial stewardship aligned with the ongoing multidisciplinary and multisectoral engagements. On the other hand, INFARM complements this effort by providing a global platform for countries to monitor and share data on AMR across animal and food systems, enabling targeted interventions and improving transparency. Together, RhinoFarm and INFARM serve as key components of FAO support for Kenya and other nations in the global fight against AMR. Looking at some of the key milestones and achievements in Kenya's AMR journey over the key years, FAO is very proud to have been part of establishing the county AMR units. Kenya's 18 CASICs, as has been highlighted by Dr. Ramona, have become vital hubs for local AMR initiatives, and FAO is committed to expanding these units to ensure AMR control measures with every corner of the country. Advancing lab and surveillance capacity, FAO has been able to move on this initiative through supporting assessment of the AMR surveillance system, and we noted during the assessment carried out this year that the progressive improvement pathway stage for AMR in Kenya moved from progressive improvement pathway stage 3 stage 1 to stage 3 in AMR surveillance, which has reflected improved lab capacity and data systems. As previous speakers have spoken, we have focused a lot on building the lab capacity, which is critical in generating the quality data that will be able to improve our AMR surveillance. Also, with regard to national action plans, Kenya is implementing the 2023 to 2027 NAP on AMR, which FAO was also a part of, in alignment with the UNGA 79 targets. And this plan includes robust monitoring mechanisms and a roadmap for AMR control. Moving forward, the main strategic focus for FAO will be scaling up surveillance and data reporting. FAO will continue to work with Kenya to meet UNGA 79's targets for quality AMR data reporting, ensuring contributions to global AMR surveillance databases. Secondly, we'll also focus on strengthening policy implementation and stakeholder engagement. By aligning Kenya's policies with global goals, FAO will support Kenya in mobilizing resources and implementing effective integrated AMR strategies in the context of One Health. We'll also continue to promote responsible antimicrobial use in agriculture through Renofarm, and FAO and Kenya will prioritize reducing AMR use on farms through biosecurity, livestock vaccination, and sustainable animal health practices. We'll also put a lot of effort on enhancing One Health collaboration, recognizing that AMR impacts every sector. FAO will as well continue to foster cross-sector partnerships to build a united One Health approach to AMR containment. Lastly, my message on behalf of the FAO representative is to let us unite in our commitment to combat AMR by educating our communities and advocating for strong policies that prioritize public health. Together, through immediate and coordinated action, we can protect lives and ensure a sustainable future for all. Thank you for your attention, and I wish us all a successful WOW 2024.
Thank you, Joshua from FAO. Could we have our next sponsor, please? A hand clap for Joshua.
Good morning, everyone. My name is Ricardo Echelar. I am the Regional Emerging Threats Advisor for USAID Kenya and East Africa. Highly grateful for being here today. So thank you to everyone. Recognizing our chief guest, Judy Wasonga, representative of the PS Livestock and Development, Dr. Kandi from the Ministry of Health, Dr. Kibere from the representative CEO of KVB, Dr. Matuma from the representative of the DVS, Dr. Avoge, representative University of Nairobi, Dr. Machomo, the representative from VSRI Calro, all of our partners, and all other distinguished guests, all protocols observed. On behalf of the USAID Kenya and East Africa Mission leadership, I'd like to extend our appreciation as well to the Kenyan government and to the organizers of today's launch, including Dr. Collins, Dr. Ngumu, Dr. Kamau, Dr. Ramona, and Dr. Tunui. And I'd also like to recognize all of the stakeholders and partners here today, including, as we've heard, from Fleming Fund, from the Red Cross, our colleagues from the U.S. Centers for Disease Control and bioMérieux, and many of you who are here who recognize AMR as an important issue that we have to address. So as we all know, the World Antimicrobial Resistance Awareness Week is an annual reminder and a call to action. And AMR is one of the priority global health security technical areas for the U.S. government, and is a strong example of the partnership that the U.S. has had with Kenya over the last 6 decades. Now, we are here today because we recognize antimicrobial resistance, also known as AMR, as one of the greatest public health threats the world is facing. We've heard this repeatedly this morning. And also we heard that this was highlighted during the second high-level AMR meeting during the UN General Assembly that took place a couple months ago. And during this meeting, we also heard that by 2050, there will be nearly 10 million preventable deaths due to AMR, and an economic impact globally of nearly 100 trillion US dollars. And in Kenya, AMR could have dire consequences in the push for increased primary health care. As a result, people have termed the threat of AMR as a slow and silent tsunami. Proper antimicrobial stewardship is one of the most important public health actions that we can take today, and by coming together to work through a One Health multisectoral approach, we are working to prevent this tsunami from becoming a reality, thereby protecting the ones we love and protecting future generations. But to fully address the threat of AMR, as we've heard, we must work to bring multiple sectors together at the national level, county level, and in communities. This includes bringing human health, animal health, and the environment together for coordinated action, and we must not forget the private sector. This includes active surveillance to monitor the risk, working with consumer groups to increase awareness and education so that individuals understand the proper use of antimicrobials, strengthen infection prevention and control measures, including increased access and availability to safe water for improved sanitation and hygiene and proper waste management, research and development for new prevention tools, including vaccines, and working closely with the animal health sector, recognizing the role of improper antimicrobial use within agricultural production. The good news is that all of this is already outlined in the National Action Plan on Prevention and Containment of AMR 2023 to 2027. And Kenya is leading this charge through its National Antimicrobial Stewardship Interagency Committee, and at the county level through the CASIX as well. And Kenya serves as an important example to other countries in East Africa and around the world. And as part of this leadership, I also want to commend the Ministry of Health and all partners in the launch and for hosting the new online patient health workers safety documents portal and mobile application. So to conclude, to address AMR, it will be a marathon and not a sprint. Something that I know that Kenyans do well and exceed and lead at. So I have great faith in the work that you all are doing, not just today, but those who will be presenting your research and of the future. So thank you to all. Asanteni sana.
Thank you, Mr. Ricardo. Could we have CDC? Are we in the house? Thank you.
Good morning. Yeah, thank you. Our chief guests, Mr. Jude Wesonga, Dr. Kadie, representing the Ministry of Health, Dr. Benson from the CU, KCB, Dr. Evans, DVBS representative, Dr. Gabriel, representing the Dean, University of Nairobi, Dr. Monica from Carlo, and all partners and all protocol observed. My name is Dr. Linus Degwa, representing our country director from US CDC, and want to say thank you to the organizers for inviting us and for this great occasion, which I'm proud of and to be part of from the first Wow Week that this country started celebrating in 2017. As CDC, we are honored to partner with the Ministry of Health and work as part with USAID as USG to support the work of AMR IPC in this country. One of the important aspects to mention is that in terms of seeing this work grow, CDC in 2015 started with 2 AMR surveillance sites, which, as you have seen from Dr. Ramona, have increased to 20 sites. And we continue working with our implementing partners to ensure that robust data, laboratories and the technicians are able to produce quality data. That is very important. In terms of enabling to achieve the NAP, which Dr. Ramona alluded to quite well, CDC has worked very well with the Ministry of Health, and especially in coordination and supporting the establishment of the county antimicrobial stewardship interagency committees, the CASICs, and in collaboration establishing the CIPCAC, the county IPC coordinating committees. Because as you've seen that without IPC, we are not going anywhere with AMR. In terms of awareness, as CDC in 2017, we established and supported the Ministry of Health in establishing the ECO platform, which we are proud of to see that most of us, and that has grown to integrate One Health concept, which is learning every 2 weeks. And that is really kudos to the Ministry of Health. Since we handed over that platform, they have continuously supported that. And in terms of supporting the AMR surveillance and monitoring, from our 2 sites, we have expanded and we continue working together with our implementing partners to ensure that that surveillance, the data is actually quite robust. As I end, I want to say that AMR is our silent enemy, as we have learned from the data. And not only an enemy, it's a real terrorist. It does not segregate whether you are high or low, rich or poor. It doesn't segregate whether you are an animal or a human being or in the environment. This we must all come together to fight, because it's a real terrorist, and we must all get engaged in fighting the AMR, which is antimicrobial resistant. And as we think about it, it's not only the AMR in the bacteria sector that is antibiotic, we're also talking about the AMR in the fungi, in the virus, and also in the parasites. So I would like to really acknowledge our implementing partners. The University of Nairobi are here, represented by Dr. Lois, ICAP represented by Doris, WSU and FHI 360, and APHL and AMREF. With that, I want to say thank you for inviting us.
Thank you from CDC. A better clap, please. Thank you. So could we have our next speaker? Biomerio, are you in the house? Thank you.
Thank you. So the chief guest, Mr. Jude Songa, senior leadership from the One Health Ministries present here this morning, the distinguished guests from various state and non-state actors involved in the AMR, AMS space. Ladies and gentlemen, all protocols observed, good morning. So my name is Dr. Kiplangat Sigei. I'm representing Biomerio. For those who may not have heard of this elegantly named diagnostic company, Biomerio is a French company that has been involved in diagnostics for over 60 years. And we pride ourselves in being a key diagnostic partner of choice for various agencies represented here and across the country. So our role in diagnostics has been to ensure that the labs function well, and we are happy that we have a good relationship with most as we continue to build other relationships as well. So in terms of what we've done in supporting the National Action Plan, our main focus areas have been the two main objectives relevant to us, which is supporting the appropriate use of antimicrobials through ideal diagnostics as well as well-equipped healthcare workers, and then strengthening research and surveillance through various projects. And we continue to work with a lot of you in the room and others who are not here, and we want to continue doing this going forward. So I think for us, we're happy to be here. We're happy to support the WOW Week, and we are always open for further discussions and further engagements on how we can expand diagnostics, not just for AMR, but across various fields. And I want to echo one of the speakers who talked about sustainability. We are here as a manufacturer, and we are willing to discuss. Sometimes we feel there are barriers towards accessing some of the diagnostics, but we're very open, and some of the facilities, not just here but elsewhere, can attest to that. So I think our parting shot as Biomerio is, without diagnostics, healthcare is blind. Thank you very much.
Thank you, Biomerio. I hope I got that right. So, do we have our next partner, the World Organization for Animal Health, a representative from WOA? If not, WHO, World Health Organization. Thank you, Daktari. Karibu sana.
So my name is Mark. I work for the World Health Organization, Emergency Preparedness Response Program, but one of the areas which we tackle also is One Health, which encompasses AMR. I didn't know I was supposed to speak, but I'm here on behalf of our country team lead, Dr. Abdurrahman Diallo, who is engaged in another activity. And as WHO, I think Joshua from our sister organization in the UN, FAO, he has had an in-depth speech. And I will qualify that as behalf of the quadrupetite. But just to be clear is that the quadrupetite is a joint secretariat that brings together the 4 UN agencies. And until 2 years ago, I think UNEP came on board to strengthen the environmental aspects. The quadrupetite is hosted by WHO, and it's a multi-sector engagement in AMR. And just maybe to mention a few things that probably WHO has been taking lead, both at the global level, but also the commendable job that was detailed here by Dr. Ramona from the DVS. So the Global Leaders Group on AMR, I think, is a unique platform that actually has involved partners, to come together in terms of capacity building. And one of the areas that WHO actually strengthens is capacity building. When you go online, you'll find modules on AMR, and these have been adopted actually locally. I think last week we were in a public health emergency meeting where we were reviewing some curriculums to train local responders. And the way actually is to have the digital learning platforms hosted by the ministry that also are supported by WHO and others to integrate AMR as part of the One Health curriculum. Having said that, most of you are aware of the Access, Watch, and Reserve. This is a classification of antibiotics that has been developed by WHO under the Stewardship program. So it's very important for clinicians actually to understand the dosages, the route of administration, and actually the choice of antibiotics, whether they're the first-line antibiotics or second-line antibiotics. And so this is being championed by the AWARE platform by WHO. But all of us refer to glass. Glass is not actually the glass that breaks. but this is a surveillance system on the use of antibiotics that has been championed for a very long time by WHO. Very keen to see what FAO is doing actually with the infam, and I think that actually now complements, the whole picture of AMR surveillance, building upon many years of the revised strategy of GLASS that was revised actually a few years ago. When we look at the priority pathogens, this year, WHO has revised the list of priority pathogens. And actually, most of them, as most of you will understand, Klebsiella is one organism that has been actually, troublesome in terms of the IPC. And these priority areas will form the agenda for the next few years that will be focused on in terms of actually strengthening the quadrupetite. But just to echo the words of the WHO Director General, Dr. Tedros, last week in the high-level ministerial panel discussions, I think there are 4 key takeaways where WHO is focusing. We must be cognizant that finances is a challenge, and therefore the issue of sustainable financing from both domestic and international must be sustained. We are aware of over-reliance on foreign funding, and I think this has affected the agenda that is set forward in terms of what are the priorities of countries. But more importantly, the issue of increasing equitable access to quality antimicrobial use, and this actually just to ensure that drugs should be affordable to people. But more importantly, the pipeline. I mean, since the first antibiotic that was invented, the penicillin story, I think there has been a stagnation in terms of the pipeline of churning out new molecules. And I think the main platform that has been created by WHO is not just in terms of the diagnostics, but also in licensing new molecules that come into place. So as we continue to educate, according to this year's theme, we must actually come out very strongly to go down to the communities. And I think the commendable work by FAO and other partners in establishing the CASICs, I think this has been tremendous, which is nestled within the One Health framework. The 18 or so CASICs, I think they are working in terms of piggybacking on the efforts that have been accrued for many years by CDC starting this initiative of the county One Health units. So having said that, I think we will continue to advocate for more resources as WHO, but also we'll continue to engage high-level policies so that we act now to end the silent pandemic of AMR. Thank you very much.
Thank you. Representation from WHO. Lastly, we do have environment, representative from UNEP. Do we have a representation from UNEP in the house? Mm-hmm. There's one. Okay. So, any other partner in the house? Sponsor? That would like to say a word before we close that session. Thank you so much, and I think we're going to move to the next schedule on the timetable, so I'll hand over to Dr.
Thank you very much, various partners, for your remarks. We want to now progress to the next level of speeches. I want to take this opportunity to invite Dr. Robert Onsare from KEMRI to come and give his high-level remarks. Karibu, Daktari.
So colleagues, all protocols observed. Actually now I was going to make a speech, but nevertheless it's a great pleasure. So on behalf of KEMRI, my name is Dr. Robert Onsare. I'm currently heading the One Health Approach research program, and which we're focusing a lot on antimicrobial resistance. So it's a pleasure to continue partnering with the World AMR Awareness Week. And I want to associate myself with the remarks that were made earlier by my colleague, Dr. Olale Paul, with whom we form a consortium, that the Rocket Project. So the Kenya Red Cross Society is part of the consortium, part of the Rocket Project, and they're leading the component on awareness. And as KEMRI, we're focusing mainly on looking at the lab quality management system. From the presentation that was made earlier here by Dr. Romona, it was very clear that quality, lab quality, you want to be sure that the data that is coming from the lab is actually data that you can be able really to make decision on. So as KEMRI, we are leading the effort in terms of taking the labs through their journeys they've had through subscribing to external quality AQAs, and we are implementing this in 9 health facilities under the Rocket Project, and we are happy to be able to partner in that manner. We were also part of the Fleming Fund, and I want to associate myself with the remarks that were made by my colleague, Dr. Bliva. We were the forefront in terms of building capacity for a number of labs. We took them through the whole spectrum, right from sample reception, sample identification, antimicrobial susceptibility testing, and also reporting. And so this was during the Fleming Fund. And so we're happy to have also partnered with our consortium partners in that manner. So it's indeed a great pleasure to be part of this, and we are happy to continue collaborating really in various ways to come up with ways we can be able to mitigate AMR. I want to reiterate also a comment that was also made by previous speaker in terms of really urging the government to be able to prioritize in terms of sustaining this. When you look at the labs, and I think my colleague Dr. Mbajo mentioned this, when you visit some of these labs, quite some work has been done. We've had renovations in these labs, we've had the equipment being purchased, but then you don't want to really ask yourself what will happen, for example, if these partners really leave in the next months or years or so. Really, I want to urge the government to prioritize in any way they can be able to support actually efforts that are geared towards mitigating AMR. With those few remarks, I want to stop there. Thank you very much for your attention.
Thank you very much, Dr. Onsari. Your work at KEMRI is appreciated. We would like to hear remarks now from KALRO, Dr. Monica Maichomo. Welcome, Dr. Ray.
Hello, good afternoon, colleagues and everyone in the room. Thank you very much, our chief guest and all our high-level delegates and partners and colleagues in the different entities that we interact and addressing this very prestigious topic of AMR. I am delighted this afternoon to be part of this meeting and gathering on behalf of the Director General in KALRO and some of my colleagues in this room. We are from the Veterinary Research Institute, really where the animal health work is happening in KALRO, and therefore the most relevant to be in this meeting. So we are glad to be part of this journey addressing the AMR in this country. And I know most of us will remember and know that Moguga, whenever you hear that name, it's a blood name really in Kenya and also globally, because recall the story of the leader pest eradication, and Moguga was a reference lab by OIE then. Therefore, we have good things, we have laboratories, we have structures that can really contribute in a big way to this agenda. And we are very much glad right now to be part of the collaboration within the Fleming Fund and to avail our laboratories as one of the site for surveillance, particularly for the daily value chain. So, and going forward, we have our young early careers, and we have really been doing some stuff, but not within this collaborative consortium, and we are glad that even some of our early careers will be presenting some of the work, the data that we have been generating, and that we shall continue to generate so that we can inform the research agenda. I know we are part of the government, and I pray and hope that Voice of Reason will one day ensure that the big things we are doing in our laboratories, equipping, that it will not be an exercise in futility, because if well planned, if well deliberated, we can very easily deliver a sustainable agenda for this country, and even to resonate with the region as a force to reckon with. We are glad to be part of this AMR Awareness Week. Thank you very much.
Thank you very much, Dr. Our next remarks will be from the representative of the CEO, Kenya Veterinary Board, Dr. Benson Kibore. Karibu, Doc.
Good afternoon. Our chief guest, representing the PS, State Department of Livestock, the representatives from the DVS, from CALRO, the NASIC Secretariat, partners who are here. My name is Dr. Benson Kibore, representing the CEO, Kenya Veterinary Board, and I serve there as a director in charge of compliance, enforcement, and market surveillance. It is a pleasure to be with you here today, and basically to exert one of our roles as a board, and I think where we fit in very well in this antimicrobial fight is Act Now. The board is charged with regulating the veterinary practice in Kenya, and as such, all veterinary practitioners are supposed to be registered and retained by the Kenya Veterinary Board. With this in mind, it is our expectation, as per the provisions of the Code of Ethics 2015, that our professionals are up to the task of judiciously utilizing antibiotics. One of the ways that we are implementing the issues of the Act Now is what is provided for in law. That is the issue of ensuring that each practitioner, each clinician implements the use of prescription writing. So that is one of the elements that as a board we are now implementing very aggressively. Speakers have talked about issue of sustainability. And let me tell you what we are doing to sustain this fight. Number one, the board has already hired a team of inspectors where I'm heading that inspectorate. And in the coming days, we're going to open up our regional offices so that we can devolve the function of regulating the veterinary practice. If you looked at the data, it is projected that AMR, and as it's seen in the data presented by Dr. Romona, is that around 10 million people are set to die by 2050. You know that 10 million is, we can also be part of that here. Are you aware? So it is a question of what we do now that determines our reaching 2050. Those statistics are grave. The money involved, or in terms of losses associated with AMR, is staggering. 3.4 trillion US dollars by 2050. That is staggering. So what a board is doing is ensuring that we implement the law, the provisions of the law as it is, and I think you've seen in the previous days, the resurgence in terms of our action to ensure that we limit access of medicines only to registered professionals. So one of the things we're doing is that a lot of our practitioners were outside the regulatory framework. So somebody registers, but is not regulated by the board. So what we've done is to ensure that every of our practitioner is regulated. And so anyone who misses the 2025 register actually will have his registration certificate recalled. So that now we can differentiate between the people who are licensed to handle medicines and the people who are not allowed to handle medicines, what we refer sometimes as quacks. Medicines are tools of trade of professionals to handle infections and to limit the impact of pathogens. So when these medicines are accessed by unregistered persons, it not only poses a threat to the Kenyan people, but also access of international market through, it limits access of international market to our products of animal origin. So it not only endangers our lives, it not only endangers our existence, but also limits our economic power as a country. And that is the reason the board is actively engaging in this business, is actively instituting the speed governor to ensure that we limit access to medicines. I want to end, one of the things, if you go up country, and what has actually driven a lot of some of these AMR activities, and the silent pandemic that we are facing, is something, when you go to the village, you'll hear a farmer say, I want you to, inject for me this animal for something called climate. There's something inject called climate. So you do just one therapy, one therapy of injections of antibiotic, and that is it. That is how we've actually speeded the action of the resistance towards antibiotics. So today, on behalf of the board, I want to commit that we are in this journey together because it affects all of us. No one here is discriminated. It will affect all of us. So before it affects all of us, it is about what we do as professionals, as institutions of government, to ensure that we limit and reduce the speed at which we are seeing the emergence of the AMR. So the board is actively in this, and I can assure you that beginning the 1st of next year, we will even see a more resurgent board to ensure that we fix the animal health delivery services so that it is only the professionals and the professionals that have access to veterinary medicines. With that, I thank you and I wish you a fruitful World Antimicrobial Week. Thank you very much.
Thank you very much, Dr. Terry, for your remarks and for the great work going on. And next, we have the representative from the Director of Veterinary Services, Dr. Evans Muthuma. Karibu, Dr. Terry.
Good afternoon. Yeah, my name is Dr. Evans Muduma. I stand here representing the Director of Veterinary Services, who could not be with us today on this very important occasion because of exigence of duties. And I am also here because I also head the division at the Directorate of Veterinary Services, which is called the Division of Veterinary Public Health and Animal Product. And as we continue, you note that we will be talking a lot about veterinary public health, because these are veterinary public health issue, and also the issue of foods of animal origin. And I would start by saying that this is a very important occasion today, where we are celebrating the World Antimicrobial Awareness Week. And as the Directorate of Veterinary Services, we have been involved in the issues of AMR since the inception of this program. I don't want to go back to a presentation by my colleague, Dr. Romona, but this is one of the areas where the Directorate of Veterinary Services has been very, very passionate, very key in running the program. We have been involved in quite a number of activities. And the role of the Directorate of Veterinary Services is very clear. Number one, the DVS being the Chief Veterinary Officer in the country and a delegate of World Organization for Animal Health, and being the competent authority in animal health matters. So all the issues to do with animal health and anything related to the animals, that's the role of the DVS. So this is a role where he has taken it very seriously and has been involved in quite a number of programs. Because we have got our chief guest, I don't want to, because the chief guest is from the State Department of Livestock, and I know he's going to talk more on the issue and how we are, the ministry and even the State Department, how we are dealing with this issue. I just wanted to outline just two issues whereby the Directorate of Veterinary Services has been very much involved. As you know, the Constitution bestows the power of capacity building and technical support to the national government. And in implementing this activity on capacity building, the Directorate of Veterinary Services has been carrying out capacity building in the counties. And one of the area, the thematic area which we always cover when we are carrying out the capacity building is antimicrobial resistance and how to tackle it. We started last year, we did 4 counties. We built a capacity for 4 counties. We started with Kajiado, Nairobi, Nakuru, and Murang'a. This year, that was just last week but one, we also had capacity building for the 4 counties of Machakos, Makueni, Kiambu, and Nyandarua. And in all this, when we are doing this capacity building, we have always had a presentation on AMR and also on farm biosecurity. Because as we're implementing the IPC, the role of how you handle the drugs, how you maintain your farm hygiene, how you implement the good agriculture practices, good hygiene practices, good manufacture practices, the impact on the usage of antimicrobial. So that's one area where we have done a lot, and we are happy we have had the support from our partners to implement that very important function. We also do another very important activity, which is sensitization of the stakeholders on AMR. And this one we have done by developing the information, education, and communication materials, which we do through the support of our various partners, and at the Directorate we have got a section which deals with the issues of developing the IEC materials and also of dissemination. So that way we have also contributed a lot in addressing this scourge. So what I would like to urge you on behalf of the Director of Vendor Services is let us take our part. Let us play our role. Each of us has got a role to play in dealing with this scourge. I think the numbers which have been given there, I have scared all of us. In 2050, you have 10 million deaths resulting from AMR. That one is scary. And each one of us has got a role to play in ensuring that we tackle this scourge. And it should also start even with us, even in our homes, even in our families, in our groups. Let us spread the message. I think the theme for this year is very clear, very, very clear. And this is what we should carry home and ensure that we spread the message, because let us act now, not tomorrow. Otherwise, we are in danger of being decimated by just AMR. So with those few remarks, thank you very much, and I wish you all the best as we continue celebrating this day. Thank you.
Thank you very much. It is indeed now my honor and privilege to welcome the Director of Health Standards, Regulations and Quality Assurance, Minister of Health, Dr. Charles Kandie, to give his remarks, and thereafter to invite the chief guest. Karibu Daktari.
So our chief guest, Principal Secretary for State Department of Livestock Development, represented by Jude Wasonga, Institute Director for Carlo Muguga, Dr. Monica Maichomo, Dr. Evans Mudhama, representing the DVS, Dr. Benson Kibore, representing the CEO, Kenya Veterinary Board, Dr. Gabriel Aboge, representing Dean, University of Nairobi, Faculty of Veterinary Medicine, representatives of the government ministries, departments and state agencies who are around here, development partners and implementing partners who are here, AMR stakeholders, distinguished guests, ladies and gentlemen, good afternoon. So first, I want to extend my deepest gratitude to the organizing team led by the Ministry of Health, the Ministry of Agriculture, Livestock and Fisheries, Ministry of Environment, Climate Change and Forestry, and Ministry of Mining, Blue Economy and Maritime Affairs, the organizing committee, along with other partners who contributed to this event's success. I look at this event as soul-searching. We've come together to audit ourselves, to take stock on our ability to begin the process of changing the tide of AMR burden. And it requires us to look at that. So in addition to raising awareness to the public, to the communities, to the stakeholders within the distribution channel of antimicrobials, and also to the providers, this is the moment we need to look at. So we need to see where are we on this. So this bringing together all these players is a testimony to the One Health approach and what Ricardo of USAID talked about, multisectoral approach. So we need to act together or perish together. So where do we need to work on this? So a threat of AMR in one corner is a threat everywhere. So we need to begin to look at that to push us together. I'm good in starting or beginning an initiative. So from where I sit in the Ministry of Health as the head of Health Standard Quality Assurance and Regulation, where AMR coordination is domiciled, I'm ready to start the process. I'm ready to start the marathon, as indicated earlier, that we must begin with steps. And how do we do this? So I'm good in that. I'm not good in sustaining, not in the sense that when the programs leave, we don't have resources from the Ministry, but we can work hard on that. So as we know, antimicrobial resistance is the most challenging public health threats, rooted in sectors as diverse as health, food safety, agriculture, environment, and trade. It extends globally and nationally, with studies predicting that if unchecked, AMR could cause up to 10 million deaths annually and reduce the global GDP by 3% by 2050. So 2050 is not very far. So we need to begin the process to see what can we do for that. I wanted to give an analogy of, I am a fan of boxing. The boxing where you hit one, you punch one another on the forehead. And if possible, you also punch yourselves on we call them the body works. So in boxing, so AMR has, we were very good as human beings in addressing infectious diseases through the microbial. So we've been punching them, but they are now punching back. So if we need to start responding. If you are punched continuously and you don't respond, what will happen? You'll be flawed and we'll have no medicines to act on this. So we are now at round 4 of the boxing match. We've started. We don't want to reach round 12 before we do something. So we need to begin working on this. So this trend risks reversing our hard-won gains against infectious diseases and threatens advancement in modern medicine. Further, as international travel and trade continues to grow, unchecked AMR could jeopardize the achievement of sustainable development goals and the attainment of the universal health coverage. So, as noted by the various speakers, the complexity of AMR underscores that no single department, organization, or county can address it alone. Effective containment and prevention require collaborative action across multiple sectors, disciplines, and stakeholders. This reality is underscored by the collaborative approach embodied in the implementation of integrated projects and guidelines developed by the various stakeholders, including those who are about to launch today. So I urge upon the development partners. I know we have got the tripartite team, the secretariat. I know we have all the players together. Let's not leave anybody behind because we need to work as a team. So the government has joined regional and international efforts to reduce AMR and ensure future availability of effective antimicrobials. Our national responses are centered on implementing sustainable measures to curb AMR emergence and spread, guided by One Health approach. These One Health ministries have worked together to implement AMR policy and an action plan where we have come up with a 6-point plan. So today, let's see at those 6-point plan, where are we? What can we do to be able, so that we can be ahead of the antimicrobials as they find other ways to defeat our fight against the infectious disease. So let's work on, look at that. So as I conclude, I want to recognize the importance of sustained government resources, both financial and human, in the crucial, effective implementing, monitoring, and evaluating these multisectoral interventions. So the Ministry of Health, and we have heard your call, that what are we doing as ministries of health, as the other ministries, we need to start putting our resources together. So if it is possible, I will be calling upon my colleagues. We can develop a cabinet memo for all the ministries and come up with a budget plan that can be given at a high level. So that is my urge. I'm good in starting, so be ready. So if you see me knocking on your doors, let's work on this. We will be ready to do that. So we will be. So we will, in terms of AMR policy and national action plan, we want to receive resources towards implementing in line with the political declaration of UN General Assembly high-level meeting on antimicrobial resistance this year. The support for our development partners reflects a strong commitment on collaborating with the government to achieve policy goals for the benefit of all Kenyans. So with those few remarks, it's my now a pleasure to invite our chief guest to give his keynote address. Maybe we can do that one by standing up and we do makofi ya kilo moja. Karibu our chief guest to give us keynote address. Welcome, 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 welcome. Funga, fungua.
Thank you very much, Dr. That reminds us of where we were. I'd like to, first of all, ride on Dr. Ramona's apology for those who are getting their voices back. I'm in that group, and I thought that maybe I'll be quarantined, but since I found that it was not only me, here I am. My name is Jude Wasonga. I'm a Senior Deputy Secretary, State Department for Livestock Development in the Ministry of Agriculture and Livestock Development. I'm here representing the Principal Secretary, Honorable Jonathan Mweke, CBS, who was supposed to be here, but due to another engagement, couldn't make it today, and therefore sent me to represent him. I'll go ahead and read the speech. I'm also challenged visually, so I'll also need some assistance from this gadget as I go through my speech. This is a speech by Honorable Jonathan Mweke, CBS, Principal Secretary, State Department for Livestock Development, during the launch of the World Antimicrobial Resistance Awareness Week from 18th to 24th of November 2024. The Director, Health Standards, Regulation and Quality, Dr. Charles Kandie, Dr. Evans Mutuma, representing the DVS, Dr. Benson Kibore, representing CEO, Kenya Veterinary Board, Dr. Monica Michoma, Carro, Dr. Robert Onsare Kemri, representative of other regulatory agencies, representative from the quadruped, WHO, FAO, WOAH, UNEP, Fleming Fund, the University of Nairobi, development partners and other stakeholders, honorable guests, ladies and gentlemen. It is a great honor to join you today as we gather to observe the World Antimicrobial Resistance Awareness Week 2024. Here in Kenya, this event, organized by the National Antimicrobial Stewardship Interagency Committee, highlights our collective commitment to address one of the most urgent global health threats of our time, antimicrobial resistance. AMR is not just a scientific challenge, it is a very real and present danger to the health of individuals, communities, and ecosystems around the world. It results from the overuse or misuse of antimicrobials, inadequate infection control, and the ease with which resistant pathogens spread. The impacts of AMR are felt across our health systems, our agricultural practices, and our environment. Ladies and gentlemen, agriculture is the backbone of Kenya's economy, contributing about 33% of our GDP, and 60% of our exports. The livestock sector, in particular, is vital, contributing 12% of the GDP and providing livelihoods to over 50% of the agricultural workforce. Livestock farming is not just an economic pillar. It is a critical source of food security and social stability for countless of Kenyan families. Given the importance of livestock to the economy and rural communities, it is imperative that we manage livestock health with great care and responsibility. The livestock sector plays a crucial role in combating AMR by ensuring the responsible use of veterinary medicines. This will help mitigate risks to food safety, environmental health, and international trade. AMR threatens the growth and sustainability of the livestock sector, so the prudent use of antimicrobials, along with strong biosecurity and improved animal husbandry practices, is essential to maintain animal health and contributing to the global fight against AMR. As we mark World AMR and Awareness Week, we must also acknowledge Kenya's unique governance system where agricultural functions have been devolved to the counties. This structure places significant responsibility on local governments to tackle AMR. Each county plays a key role in protecting the health of our livestock, our communities, and our environment. Ladies and gentlemen, Kenya is making remarkable progress through the bottom-up economic transformation agenda, BETA, which aims to empower counties, communities, and citizens. It is crucial that our efforts to address AMR align with this vision. By strengthening livestock health, we are not only protecting animal welfare, but also fortifying the very foundation of our local economies. The Ministry of Agriculture and Livestock Development, through the State Department, recognizes the importance and urgency of addressing the growing global threat of AMR in all countries through a coordinated multisectoral One Health approach in the context of the 2030 Agenda for Sustainable Development. We remain fully committed to advocating for policies, guidelines, and regulations that ensure the responsible use of antimicrobials in veterinary care and animal production, as well as their safe disposal as encapsulated in the second National Action Plan 2023 to 2027. I commend the National Antimicrobial Stewardship Interagency Committee for their dedication in reviewing and developing the second National Action Plan, that is the one from 2023 to 2027, and its monitoring and evaluation framework. I also thank NASIC for preparing our country's position presented during the 2024 UNGA high-level meeting on AMR that provided for an opportunity for it to adopt a second political declaration to accelerate progress in addressing AMR at the highest level of political leadership. Ladies and gentlemen, to achieve the goal outlined in the AMR National Action Plan, we must work together. I deeply appreciate collaboration with key stakeholders, including the quadruple organizations, FAO, WHO, UNEP, and WOAH, Through the AMR MPTF program, the UK government, through the Fleming Fund, USAID, FIND, ASLM, World Animal Protection, ILRI, WSU and CDC, civil society organizations, academia, the food and feed industries, and the pharmaceutical sector. Together, we are taking significant steps to promote responsible antimicrobial use, strengthen surveillance, and implement effective stewardship practices. Ladies and gentlemen, this year's theme, Educate, Advocate, Act Now, underscores the importance of raising awareness and taking action at all levels to address AMR. By educating communities, advocating for responsible antimicrobial practices, and taking swift, decisive action, we can reduce the threat of AMR in Kenya and globally. Through capacity building, knowledge sharing, and resource mobilization, we can empower countries and the communities to effectively address AMR within their own context. Let us act now with a sense of urgency and collective responsibility to find innovative solutions and reverse the growing threat of AMR. In conclusion, ladies and gentlemen, I urge all of us here today to live with a renewed sense of commitment, to focus on specific, actionable steps to combat AMR and safeguard the health of future generations. Thank you, and may our collective efforts guide us towards a brighter, healthier future for all. That is a speech by our chief guest for the day, who was the PS for the State Department for Livestock Development, Honorable Jonathan Omwege. Thank you for listening to me. Asanteni sana.
Thank you, our chief guest, Mr. Wesonga from SDL. And as we have heard, we need to bring the youth on board to combat antimicrobial resistance. During this week, we had a competition for the youth, and we are honored to have an award ceremony for the youth. I'm calling upon Felicitas Mutuma to come forward and take us through that ceremony. Welcome, Felicitas. And as she comes forward, let's give her a clap. Thank you.
Hello everyone, how are you? All protocols observed. My name is Dr. Felistan Kirote from React Africa. So during this WOW 2024, we engaged Kenyan youth on innovation competition on essays, and we had top 4 who did very well in terms of essays on writing on how they can come up with innovative ideas to combat AMR. And I would like to take this opportunity to call upon the following youths from Kenya that we are very proud of. for being awarded the most innovative entry of the World Antimicrobial Awareness Week. So the competition was themed Educate, Advocate, and Act Now. It was also prepared by the WOW Planning Committee of Kenya. So we have 5 certificates and also a trophy for the position 1, who I'll be calling them in front and requesting the chief guests for today to come and award the certificates to them kindly. So we'll start with Certificate of Merit for Felix Omondi Ochola. Felix Omondi, if you're present, kindly come. Kindly. So Felix, his essay was the most innovative. You can come to the front. Felix is from Kenyatta University. Let's give him a word of applause. At position, second runners up, it was Nderitu Rosemary Wanjiru. Nderitu Rosemary is from the University of Embu. Thank you so much for participating. First runners-up, we have Lynette Lusimba. Followed by, so the first runners-up, there were 3 of them. We have Lynette Lusimba, we have Kathleen Ouma, and Alice Aoko Owiti. Yes, Alice. So Alice will be taking for the 3 of them.
So the clubs have to be 2 times, 3 for them.
And our winner for the innovation aces, we have Paul Musili Mutemi. He has come out all the way from Meru University. Paul, are you? Okay, the winner is not him. We can have Ndege Ngere. Ngere, are you in? Kindly come pick up this trophy. He is the youth coordinator. He was among the persons who are coordinating this competition. Yeah, he's going to be taking for him. Let's give the winner in absentia. And let's continue encouraging the youths to participate in this fight for AMR, because they come up with really great ideas, and I'm really proud to be one of them. Thank you.
Thank you very much, Dr. It's great to see generation, is this Alpha or Z? Participate this early in preventing and containing AMR. At this juncture, we want to proceed to the official launch of the WOW 2024 and a couple of strategic documents that have been developed with the aim of combating AMR in Kenya. And I will invite Dr. Nkatha Gitonga to take us through this session. And as she comes, we will need a couple of us to be here to participate in this part of the program. We will request the chief guest to come to the front. We are also going to request NASIC representatives who are here to join us in front. Our sponsors, partners, those who have given remarks this morning, kindly come to the front as well, including the representatives of the various organizations who gave their remarks. We kindly request you to join us as we officially launch WOW 2024 and the strategic documents that have been developed, I believe, over a couple of months or years that are aimed at helping us contain AMR in Kenya. Over to you, Dr. Nkatha Gitonga.
Yeah, so everyone just make your way to the sides of this lovely decorated structure. And we are all part of this, so the rest of the participants, you'll assist us with counting down so that our chief guest can cut the ribbon when we count down from 5, 4, 3, 2, 1, and then kata. Yeah? So allow me to, sorry. So let's split evenly. Let's have 2. All right. So there are a number of documents that are being launched. And I think we'll just mention them as we go through this countdown so that we see what's behind this. So participants, you indulge me and assist me in counting down. And when we count down from 5 to 1, we'll say kata. And yeah, you'll be able to cut that ribbon for us. Yes? Great. All right. So 5, 4, 3, 2, 1, kata. All right. All right, so as you heard, there were a number of documents being launched, but also quite importantly, there was the launch of the mobile app, which is the MOH Kenya Patient and Health Safety mobile app. So I would just ask you to turn your eyes to the screen so that we can just have a look at the official launch of that app, and then it will be followed with a QR code for you to be able to download. Yes, so can we have chief guest come and press the launch button for us from the... Today we've given you one. If you just come and press the launch button on the... All right, so let's count down for him again. 5, 4, 3, 2, 1. All right, so this mobile app will be able to, you can just see the documents are all uploaded. There are about 20 documents that have been uploaded, and you can easily search for them using keywords. However, it's an ongoing process. The documents that are being launched today will be uploaded there as well. We'll provide a QR code for you to scan, but you can also download the app from sdms.nphl.go.ke. So once you do that, you'll be able to log in using your Gmail account, and then it'll prompt you to download the MOH version 1 APK. You accept permissions to install from the drive, and you install the app. Open the app, and happy reading. Thank you.
So feel free to scan the QR code from anywhere you are to download the app. You will get prompted to install it, so accept the permissions. Then note that when you install the app, you're able to read the documents from the app, or you're also able to download the documents and read them offline. If you work in a part of Kenya where there's a limited internet connectivity, you have access to these documents on your hand at any time, and you're able to search by a keyword for any topic. Thank you very much.
Thank you. So I think we'll just have some photo opportunity there, and then I'll hand it back over to Dr. Collins. Thank you so much.
Thank you very much. Our guests, you may have your seats. We have come to the end of our launch this morning, the World Antimicrobial Resistance Awareness Week. I noticed some banners are missing resistance. So just a couple of announcements before I invite Dr. Emmanuel Tanui to give his closing remarks. As was mentioned earlier, we have some car keys here. It will be good if you came driving to go back driving. Those who are presenting in the afternoon, if you haven't sent your PowerPoint presentation, kindly do so. You should have received an email from me by now. But the email is amrsecke@gmail.com. And then after this, we're going to have lunch, and let us kindly be back by 2:15. Thank you very much, and I take this opportunity to welcome Dr. Emmanuel Tanui to give us his closing remarks. Thank you, Doc.
Good afternoon, everyone. So first of all, on behalf of NASIC, let me extend my sincere gratitude to all of us for taking the time to attend this national launch of the World AMR Awareness Week. Thank you very much for the commitment, for the insights that we have been able to share. The diversity of this gathering today really underscores the importance that we all place towards addressing the issue of AMR. First of all, I'd like to thank our chief guest, a representative of the Principal Secretary for the State Department of Livestock, other senior government representatives, our development partners, implementation partners, and all protocols observed. Thank you very much for your time, the time that you took to grace this occasion. Thank you for the remarks that have been made from all the partners. Thank you for the support that you have placed. I know we all face a lot of challenges when we are implementing activities, but we know with collaboration and partnership, we'll be able to address all these. So we need to carry on the call for advocacy that that spearheads the reasons why we have our World AMR Awareness Week, not just this week alone. We have all year round for us to be able to conduct the advocacy, the education, awareness. I want to appreciate the work that the World AMR Awareness Week Planning Committee has been doing over the course of the last several months. They have been meeting every week since September to be able to make this day a possibility. We have had several subcommittees that have worked tirelessly to be able to make this launch a reality. We have subcommittees responsible for this high-level launch and resource mobilization. We have had subcommittees organizing the AMR Scientific Symposium. We have subcommittees organizing the advocacy and awareness who are responsible for designing the awareness materials. So all the banners, materials, the t-shirts that you see are courtesy of the work from the advocacy committee, and kudos to all this good work. We've also had the subcommittee on youth events, and as you have seen the awards that have been awarded, this competition was held courtesy of the work that the subcommittee oversaw. We also appreciate the counties. We have a number of activities that the counties have planned today and even the course of this week, and we really appreciate the collaboration from the counties, because we know work and action happens at the county level. In the afternoon and tomorrow, we'll also have presentations during the AMR Scientific Symposium event, and we appreciate all those who have been able to submit their abstracts, and congratulations to all those who are selected. We appreciate the work that you have done and sharing the knowledge and evidence around AMR that is going to happen. We appreciate the support of the partners also, who have made it possible for us to have this event, from the venue to the lunch, the awareness materials that we are going to use to create awareness around AMR, and even the support for the media breakfast that we had in the morning. I think this was a very good opportunity for us to engage together and find ways in which we can take the message even beyond the confines of this venue today. For the documents that we have seen here, I think the onus is on all of us now to disseminate these documents. Implementation is very important for us. Let us not allow these documents to exist within the apps and even our shelves, but it is really important for us to ensure that all stakeholders are aware about these documents. I also want to appreciate the other teams behind the scenes who are doing the live streaming, the photography, the hotel for hosting us. Thank you very much. I'm sure we have all had a good time, and we are going to, as we are going for lunch, we'd really want to appreciate all the work. So I think for us, the parting shot really is behind the theme for this year, educate, advocate, acting now. We are called to action for all of us to play a key role either at the personal level or at being able to mentor others, creating awareness about not just this week, the days ahead. Let us continue advocating for timely interventions to address AMR and even providing for funding. The time to act is now, and I want to reiterate the call that we had today in the morning from our colleague Dr. Karis. AMR may be invisible, but I am visible. The time to act is now. Thank you very much. And just before I end, I want to welcome all of us to the afternoon session. We are starting a very interesting, vibrant, and engaging AMR symposium, where we have plenty of presentations, abstracts, and so forth. Otherwise, thank you very much to all of you. Thank you. All right, so I've been reminded that we need to do a group photo. Kindly persevere with us for just 2 more minutes for the chief guests. Our chief guests, the speakers who made the remarks, the partners, sponsors who made the remarks, please come to the front so that we do a group photo in commemoration of this launch. Thank you.